variety of reasons in which many women will just opt of their own accord to have a caesarean section, and I think that we should be respected. Frequently in our community at the moment, we have many women who feel that they've been pressured or forced to have a vaginal delivery, and often that pressure comes from the people who care about them and love them the most. It comes from family members, our sisters, our mothers, other people who create an expectation that we should try and have a vaginal birth at all costs. And some of those costs can be quite significant. We know that women who have vaginal birth, whether it's with instrumentation like forceps or vacuum, or without any intervention, have significantly increased risks of pelvic floor dysfunction, of incontinence in later life, as well as discomfort. The recovery from a caesarean section, on the other hand, is far, far more predictable. We know that as a general rule, women will have a spinal anaesthetic or an epidural top-up for their caesarean sections. They tolerate the procedure really well. They're usually up and walking the next day, and then over the next sort of 7 to 10 days, their lives will slowly return to normality. That kind of predictability is not always there when people have a vaginal delivery. Sometimes it can go exceptionally well and the baby just falls out, and women are well and truly on the road to recovery the same day. And sometimes, unfortunately, we have women that will suffer lifelong consequences of a traumatic vaginal birth. And in fact, they may well opt to have a caesarean section the next time because of that kind of trauma. Another very valid reason that we perform caesarean sections is because a woman has made the informed decision that she has chosen to have her baby via that route, based on the risks and benefits of vaginal delivery versus caesarean section, that she has chosen to have a caesarean section, and I think we should be really supportive of that to try and make sure that her birth experience is as good as it possibly can be. We know that women who have caesarean section as compared to a vaginal delivery experience significantly lower rates in terms of the rest of their lives for things like pelvic floor dysfunction, urinary incontinence, pain on intercourse, and a variety of other things. These are many reasons that women might choose to have a Caesar over a vaginal delivery. We also know that their recovery route is significantly more predictable. We know that the vast majority will either have a spinal anaesthetic or an epidural. They'll tolerate the procedure very well, they're awake for it, they might be involved in it, in that they might be involved in a maternally assisted Caesar where they'll deliver their own baby at caesarean section. They can still have skin to skin straight away. The next day they'll be up and walking around, and then over the next 7 days to 10 days we'll make much more of a road to recovery. For many women, this predictability, this very much knowing exactly what they're going to experience when and where and how is really important. Section really should not be a dirty word. The incredible amount of expectation and pressure that we put on women to strive for vaginal delivery is immense. Sometimes those pressures come from the most unintended of places. The women in our lives who care about our women the most, their mothers, their sisters, their grandmothers, having had a less than perfect birth experience themselves, will regard that as some sort of a rite of passage that everybody has to go through. The reality is that, as I've said before, roughly a third of women will be unable to deliver their baby safely via the vaginal route. And when that happens, it's important for us to recognise that there's no failure on behalf of that woman or on behalf of that baby to not have a vaginal birth. But sometimes the decision that we need is not the decision that we want to have to make. Some of the reasons that we try and lower the rates of caesarean section globally have little or no bearing in the context of a woman or a family having a baby in 2023 in Melbourne.